Dr. St. John, Executive Director of CARPHA, Dr. Lisa Inda, Director of Surveillance, Disease Prevention and Control, Dr. Mark Sami, Director of Corporate Services, CARPHA, Dr. Radix, Director of Human and Social Division at the OECS, Dr. Tamu Davidson, Assistant Director of Surveillance, Disease Prevention and Control, the Department Management Team at CARPHA, the leadership team and heads of units of the OECS Commission, other members of staff of the Commission and CARPHA, members of the media, good morning. The relationship, as you have heard, between CARPHA and the OECS PPS has been a very long-standing one, and more specifically existed when the Medicines Quality Control and Surveillance Department, CARPHA, was called the Caribbean Regional Drug Testing Laboratory. However, it has since evolved, both professionally and personally for the persons involved, to become a family as the two units have worked closely to ensure the testing of medicines based on the CARPHA risk surveillance approach applied to the testing of medicines. The OECS PPS was also an integral part of the development of this risk-based approach and has since adopted the approach to select the medicines that it tests. Over the course of the relationship, there have been some notable achievements. The development of the OECS PPS risk-based approach to the selection of medicines for testing, the identification of substandard and falsified medicines in OECS member states, technical advice in understanding and interpreting required testing for pharmaceutical products, the participation of the OECS PPS in the inaugural pilot post-market surveillance program in 2018-2019, and the participation of PPS in the 2021-22 post-market surveillance program, the acceptance of CARPHA's Caribbean regulatory system recommended products for procurement, and the sharing of information with CARPHA/CRS on identified substandard and falsified medicines. And I'm sure for the audience, there's no question about the importance of this matter of identifying substandard and falsified medicines. That is a critical safeguard in our relationship. So this relationship has brought us to where we are today. The signing of this MOU will make official and be recorded in the annals of public health the commitments of both organizations in one, facilitating access by OECS PPS to technical proposals of recommended products, the sharing of information or reports of quality and safety issues related to medical products reported to the Regional Pharmacovigilance Network from CARPHA member states, support to the OECS PPS in providing advice and responses to queries about medicines testing provided by CARPHA, MQC-SD, or any other laboratory that OECS PPS uses to access compliance to specifications of quality testing of medicines. Further, because of this relationship, the OECS PPS has been able to identify one manufacturer supplier who has supplied pharmaceuticals that we can safely and categorically be identified as not meeting the recommended quality standards. This manufacturer has subsequently been delisted from our list of pre-qualified suppliers. Finally, the formalization of this relationship with an MOU will strengthen the trust of member states in the medicines used in our public health systems within member states of the OECS and CARPHA respectively. I consider the relationship with CARPHA and the OECS to be an exemplar of intra-regional collaboration that has evolved significantly since the pandemic. We have walked every step of this perilous journey together, clasping hands tighter whenever the going went rougher. We have benefited from your professional advice, your lead, and your guidance, and you have had an uninhibited direct access to the OECS authority and a permanent role in our health ministerial as well as relevant technical working groups. I thank Dr. St. John and every member of her proudly professional team for the opportunity to continue our collaboration and look forward to meaningful impacts in the member states. Thank you.
Thank you, Master of Ceremonies, Dr. Didicus Jules, Director General, OECS Commission, Dr. Carleen Radix, Head of Human and Social Development Cluster of the OECS Commission, Ms. Rosalind Opal, Head OECS Pooled Procurement Services, Mr. Abraham Weeks, our very able chairman and also senior technical specialist with the OECS Pooled Procurement Services, and the executive management team and the departmental management team and staff of CARPHA, OECS staff, other invited guests. Good morning.
Morning.
Thank you for joining us on this significant occasion as we cement yet another partnership between the Caribbean Public Health Agency and the Organization of Eastern Caribbean States Commission. The Organization of Eastern Caribbean States and the OECS Commission, by extension, have been important stakeholders of the Caribbean Public Health Agency in the execution of its public health mandate, not only in the OECS, but also in the wider CARICOM region. This Memorandum of Understanding is an expression of the quality of the working relationship between the OECS and CARPHA, building on notable partnerships, including the CARPHA OECS Help Desk, the letter of agreement for the joint implementation of the Tourism and Health Program in the OECS member states, OECS participation in other committees of the agency, including Caribbean MOUs, the Regional Coordinating Mechanism on Health Security, and CARPHA's participation in OECS committees, such as the current collaboration on the execution of work under the OECS World Bank grant. The work of CARPHA within the OECS member states is further strengthened through its direct relationship with the OECS Help Desk, through the established role of CARPHA's Senior Technical Officer. Through this relationship, the agency continues to work towards strengthening coordination between CARPHA and the OECS Commission to ensure that the needs of the member states are well articulated and understood, and that there is greater alignment of CARPHA's work plan with in-country needs and alignment with the OECS Commission's strategic priorities. So what are the likely benefits of this particular agreement? This agreement will strengthen the relationship between the Caribbean regulatory system, additionally reaffirm the long-standing relationship with the Medicines Quality Control and Surveillance Department. And you heard of the relationship with its progenitor. And the pharmaceutical procurement services of the OECS by supporting and improving access to quality assured medicines and the monitoring of their safety, quality, and efficacy in the OECS, other CARPHA member states, and in the global community. We are aware of the challenges faced by small markets that may not be attractive to pharmaceutical manufacturers due to the size of the markets and the legal frameworks related to regulation of medicines in the individual OECS territories. The OECS Procurement Service leads the region in its approach to pooled procurement to optimize economies of scale to tackle this obstacle. To this end, CARPHA is pleased to strengthen this work at a technical level, and we anticipate that the respective medicines departments of the agency will support and enhance the procurement and regulation of medicines in public sectors of the OECS territories. And this is how we plan to do it. The Caribbean regulatory system will support procurement of medicines by recommending safe, efficacious, quality assured medicines which have been verified using reliance on trusted regulatory authorities. For example, the European MA, US FDA. For pooled procurement for OECS member states, its associates, and other CARPHA member states. At the level of national vigilance, through the online collection and sharing of spontaneous reports of adverse drug reactions and suspected substandard and or falsified medicines identified among OECS countries by persons in public and private sectors. As well, international manufacturers with approved products in the OECS or in other CARPHA member states submit reports of adverse reactions, etc., which they receive directly from doctors. At the level of global vigilance, by sharing these alerts and summaries of suspected adverse reactions and of substandard or falsified medicines, and by submitting reports to global databases like in WHO, this will be done on behalf of member states where needed. CRS will also focus on the identification of high-risk medicines by sharing medicine safety and quality issues identified regionally or globally that may inform priorities for quality testing, risk-based surveillance, regulatory actions, inspections, guidance for health professionals, and public education. And in cementing its long-standing relationship, the Medicines Quality Control and Surveillance Department will support procurement, surveillance, and monitoring of medicines through its risk-based post-market surveillance program for the CARPHA member states and for OECS regulatory needs. MQCSD will provide laboratory testing services and advice to assess the quality of medicines already procured and distributed on the markets of OECS countries. They will confirm good quality or identify potential substandard or falsified products for regulatory action. The OECS, through its pharmaceutical procurement service, volunteered to be one of the agencies in the pilot phase of this post-market surveillance program, which is the first of its kind in the Caribbean. In terms of national, regional, and global vigilance and information sharing, with the permission of the OECS PPS, the MQCSD may share the results of laboratory testing that inform not only the OECS countries, but other CARPHA member states of products that have passed or failed to meet test specifications, improving vigilance of medicines at all levels, enhancing collaboration and information sharing for regulatory decisions and activities. Both of these units will support capacity building and collaboration among regulators, procurement officers, pharmacovigilance officers, and quality systems personnel through meetings and workshops. This collaboration overall is unique because it brings two regional institutions closer to support access, vigilance, and quality control of medicines in public sectors of the OECS. It demonstrates the commitment of both agencies to optimize efficiencies of regionalization, to strengthen procurement and monitoring of safety, efficacy, and quality of medicines. CARPHA will ensure that this partnership is sustained as we continue to serve the citizens of the OECS. But before I end, I would like to acknowledge the engagement and contribution of Ms. Rosalind Opel, Head of the OECS Procurement Services, Mr. Abraham Weeks, Senior Technical Specialist, OECS Pharmaceutical Procurement Services, and Ms. Begonia Sagasti, PAHO Advisor in the Office of Caribbean Cooperation, who assisted in initiating and advancing the framing of the agreement. And with these few words, Director General, I bring my remarks to a close.
Dr. Dickus Jules, Director General, OECS Commission, Dr. Joyce St. John, Executive Director, Caribbean Public Health Agency, Dr. Lisa Indar, Director of Surveillance, Disease Prevention and Control of CARPHA, Dr. Mark Sami, Director of Corporate Services, CARPHA, leadership team of the OECS Commission, our department management team, CARPHA, heads of units, members of staff, members of the media, everyone who is here. It's my pleasure to give some brief closing remarks at this very important ceremony. This signing of the MOU between OECS PPS and the appropriate areas of CARPHA is another example of the continuing relationship between CARPHA and the OECS Commission. It's another example of the fact that within the Caribbean, we work better together. We work together at the level of the OECS. We work together in health at the level of CARPHA. And we multiply that when we work together between the regional agencies. The long-standing history of pooled procurement within the OECS is another example of working better together. And this MOU shows or recognizes that the benefits of working together go beyond the economic benefits of saving $1, which is very important in these times, but goes to ensuring the safety of the citizens of the OECS and the wider Caribbean. I want to take time to recognize that continued value that has been brought long-standing by OECS PPS, the Pharmaceutical Procurement Service, which has now become the wider Pool Procurement Service, and the predecessor in the Caribbean Drug Laboratory that has become a part of the Caribbean Public Health Agency. Now, in putting this session together, I want to recognize our communications teams, both at CARPHA and at OECS. I think we've become clear partners, working better together, not just putting things like this together, but ensuring that when we communicate the public health messages to our people, that we work together and coherently. So I want to thank you, as well as all of the participants and persons who have put this together. On our side, I want to recognize Mr. Abraham Weeks, who's led putting this together, as well as Ms. Roslyn Opel. And let me just end by saying a special thank you to our leaders, Dr. Jules and Dr. St. John. It is your vision that has guided us strategically to continue to make these partnerships across the two agencies and to multiply the benefits that we get from working together. So with that, I'd like to bring this ceremony to a close and to thank everyone for participating And let me just say to our media colleagues, thank you for spreading this message about what we've been doing together for the people of the OECS and the wider Caribbean. Thank you.